There is a massive fork in the road when you start Medicare, and picking the wrong plan can cost you thousands in medical bills or lock you out of your favorite doctors. You have to choose Medigap or Medicare Advantage. One has higher upfront costs but total freedom. The other has $0 premiums but strict rules. Today I'm going to show you which one actually fits your lifestyle for 2026. I'm Aaron, the Medicare Insider. First, let's look at Medigap, or otherwise called Medicare Supplement plans. The freedom. You can see any doctor in the country who accepts Medicare. No networks, no referrals, no prioritizations. The cost, you may have a higher monthly premium, but your medical bills are almost zero. It's a fixed cost healthcare. Now, Medigap plans are guaranteed renewable, which essentially just means once you're in, you're in. So no matter what happens to your health after the fact, or if you're moving anywhere else in the country or traveling, they can never cancel the plan on you or change the benefits of how the plan works. As long as you own that plan and you're paying the premium, that plan just follows you wherever you go and works the same way forever, guaranteed. Now, Medigap plans are also standardized by the government. The most comprehensive and most popular Medigap plan is called the Plan G. So in simple terms for standardization, a G is a G. Every insurance carrier that offers the Plan G is the exact same medical and hospital coverage as any other Plan G, so the only main difference is what each carrier charges per month. So you just look at the A-rated carriers. They're rated by AM Best Rating. That means they have good financials, a well-established company, and go with one of the lowest cost options so you don't overpay for standardized coverage. This is where some people can still be a little confused and ask questions like, well, what if my doctor doesn't take the Plan G I chose with a carrier like Humana, United Healthcare, Blue Cross Blue Shield, etc.? Remember, there are no doctor networks at all. The only question you ever have to ask any doctor or facility is, do you accept Medicare? And since over 95% of doctors in the country do, they have to accept your Medigap coverage like the Plan G as well, because they are only the secondary bill payers. That's all they can do by law. That means once Medicare pays their portion, the Medigap supplemental plan has to pay their portion by law every time. So they cannot deny a claim once Medicare's paid their portion as the primary insurance. That's why there's no prior authorizations or drama of insurance, as I like to call it. Now, here's the catch with these Medigap plans is they don't include drugs. You have to buy a separate Part D plan, which remember, that has the new $2,100 out-of-pocket cap this year to help protect you. They also don't cover dental or routine vision, so you would be on your own for finding some standalone dental and vision coverage, but that would be separate without any kind of enrollment window or penalties if you wanted it. Just completely optional and separate. All right, so now that we've covered the Medigap supplemental plans, then there's the Medicare Advantage, otherwise called a Part C, the cost. Many plans have a $0 premium, and then you only pay for when you use the plan for things like doctors, physical therapy, MRIs, surgeries, etc. And these are considered your copays. Now the extras, they often include things like dental, vision, and even some programs like Silver Sneakers, which is basically like a glorified free gym membership at a local gym. Now, here's the catch with the Advantage plans. You're restricted to a network of doctors, so these are typically your HMO and PPO type of plans. They become your primary insurance because by law, they're required to cover everything Medicare A and B cover at a minimum. If your doctor leaves that network, you might have to find a new doctor, even if that happens in the middle of the year. And that doesn't necessarily mean you can just change your plan unless there's a special enrollment period. Plus, the insurance company has to approve many services before you get them, and these are referred to as prior authorizations. Now, and that just means that the Advantage plan through the insurance company you're choosing is managing your healthcare. Now, here's the insider nuance, the trial right. If you try a Medicare Advantage for the first time and realize the networks are too restrictive, you have exactly 12 months to switch back to original Medicare and buy a Medigap plan without any medical questions, as long as your Medicare A and B started at the same time and you're still 65 years old. But wait longer than a year, you might be locked into a Medicare Advantage plan for life if you have pre-existing conditions, so don't let that clock run out. If you chose to not enroll into a supplement plan or an Advantage plan when you first got onto Medicare A and B, then generally you only have a 6-month window to get into a Medigap supplemental plan where it's guaranteed regardless of health. So just be careful of those timelines. And deciding between these two is the biggest step, but it's not the only one. Even after you pick a plan, there are typically 5 huge misconceptions that most seniors fall for, and they are expensive mistakes. I've listed them all in my next video right here, the top 5 Medicare myths of 2026. Go ahead and click that now and let's make sure you're not falling for them.